Hi, I'm Rebekah, and I'm here with Husak Wellness. And today we're going to be talking about why what you're doing isn't working. So let's get right into it. Well, what is the issue? You are a busy business owner and you just don't have time to be wasting time on things that don't work, right? So you've tried the anti-inflammatory diet. You've tried this medication and that supplement. You've tried going to this program and that program, and just really nothing has worked for you the way that you wanted it to work. You just haven't seen the results that you wanted to see, or maybe you saw some results for a while, and guess what? They're back now. So why is that? Well, before we're going to talk about that, let's talk about real quick. Let's talk about the symptoms. So let me share my screen with y'all. Okay, so what is a symptom? Well, when you think of a symptom, think of it like a weed in a garden. Okay, so how many gardeners out there? Raise your hand. Yeah, you, not me. I'm gonna take my hand down. So think of a weed like a garden or a weed in a garden. Think of a symptom like a weed in a garden. And you know, what's underneath that weed? So let's take a look at that. So here we have your symptom, right? And below it, we got this soil here. So the soil is some direct and indirect causes. So that's the diet, that's nutrition, that's lifestyle, okay? And other things. And then we have below it, down here, the little things attached and growing the weed, which is the root issues, okay? So those are what's growing those symptoms. And these are here long before that weed even pops up, before you even get your symptoms, okay? So what happens when you pull a weed? I know y'all know. Well, if you pull it without the root, the weed just grows back. Yes, and it's not as pretty as this little flower here. No, it's nasty. And then a lot of them pop up, and you know what? The problem just gets worse, right? So what do we do? Well, first, we deal with the symptom, right? So you come to us with the symptom, we do a health evaluation. So we do some fat gathering and analysis. We identify and discover what the direct and indirect causes. Okay, then we do a further investigation. We do a cellular health screening, and there we're able to identify the root causes. So the things that are actually that this weed that your symptoms is actually coming from. Okay, now most people are used to the Western medicine model. And what the Western medicine model doesn't do is they do not do a full health analysis. So you'll go to the doctor, you'll answer some questions, but they're not getting down to the diet, the way you're eating, how you're eating, the nutritional levels. They're not getting down to lifestyle. They're not getting down to those direct and indirect causes. Also, they are singling out symptoms. So, they see a thyroid issue and they treat the thyroid. They see a sinus issue, they treat the sinus. They see pain and inflammation, that rheumatoid arthritis, and they'll single out those areas, right? And how do they do that? They do it with synthetic medication. So this synthetic medication is addressing the symptoms, right? So you get relief, but then over time, what happens? Well, if you stop taking that medication, then the symptoms come back, or worse, you would start developing other symptoms that were not there before you started taking those things, right? And so medications, they are not addressing the root causes. So then what happens? Well, your overall health declines. So we're talking about, either you're getting worse symptoms or you're on more medication. You don't feel better than when you first started seeing that doctor. And the worst case scenario is death, right? Talking premature death. We all know somebody that went way too young, way before it was their time. So, there's the end factor there. So how do we work? What is our system? Well, our way is we do a full health evaluation. So we're looking at your whole life from, when you were born to now, because believe it or not, you're going to carry things with you from that time. We're looking at your diet. We're looking at your lifestyle. We're also looking at emotions and the spiritual sense. You're a faith-filled believer, so you've read your Bible. You know that things are passed down to generations. We see it even very commonly now with things like disease, diabetes that runs in families, blood pressure that runs in families, mental health disorders that runs in families. So we know things are passed down spiritually. So we do a full health evaluation. And then we do a holistic system and investigation. So we're looking at all the symptoms as a whole. We're not just singling out the symptoms. And then we address the root causes. So we're using things like diets, lifestyle changes, natural supplements and herbs and other holistic modalities. And so what's the result? Well, you become symptom-free. That's the goal here. Symptom-free, not dealing with those issues, and long-term results, vibrant health, right? So it's very important to get down to the root cause and not cover it up with things that aren't working for you.